Hello, my name is Alexandra Isaldo Rocha, and today I will be discussing the genetic disorder known as Fragile X syndrome.
Contents. I will be describing the disease along with its demographic and anatomy and its physiology and symptoms. I will also be discussing diagnosis and treatment options, and I will also be discussing artificial intelligence tools that help with the disease. Description of disease. Fragile X syndrome, FXS, is a genetic disorder that is an X-linked dominant pattern. The X chromosome is affected when the gene Fragile X messenger ribonucleoprotein 1, FMR1, has a triple mutation which is known as the triple CGG repeat. The number of times the CGG repeats will affect the production of FMRP, which is needed for brain development. Okay, so let me move my camera and I can show you the picture that we have right here. On the left is a normal X chromosome that is very smooth, it's very consistent. And on the right, we have a fragile X chromosome, which on the top, everything looks normal, but as we get to the bottom, we see a fragile site where has been affected. Demographic. Who is affected? FXS is the most common cognitive development disability where men are more severely affected than women. In the US, 1 in every 4,000 males are affected, whereas 1 in every 6,000 to 8,000 females are affected. 2 in 10,000 people in the European Union are affected by FXS. So this checks out. That does make sense because with females, they have an extra X chromosome to help if the first X chromosome is affected in any way, whereas males do not. They only have one X chromosome. So that makes sense why males are more affected than females. Similar to the last slide, we have an image that displays one normal X chromosome and one chromosome that falls under the Fragile X syndrome, where the bottom does have a little fragile site. We also have some world statistics on the bottom. Anatomy of the disorder. FXS affects neurodevelopment in the brain. The genitourinary system can also be affected. This includes gonadal tissue. In males, this is the testes. In females, this is the ovaries. This disorder can also alter connective tissue in the cardiovascular system. On this image to the right, we have male gonadal tissue and female gonadal tissue. We also have the testes and the ovaries. Now we will discuss the symptoms of the disorder. FXS can cause mental disabilities and learning/behavioral disorders that include anxiety, ADHD, autism spectrum disorder, and ADD. This disorder can cause an impaired ability to maintain focus or create impulsive or hyperactive behavior in children. Some symptoms show speech development delays by age 2. And a third of diagnoses have characteristics of autism that include impaired communication and cognitive skills and social interactions. Also, seizures occur in 15% of males and 5% of females that are diagnosed with FXS. On my right, we see a brain scan of a normal person's brain and a person who has been diagnosed with FXS. As you can see, there is a lot more red brain activity in the control brain, and in the FX disorder brain, there is a lot less red, a lot less control. Since the X chromosome is associated with determining sex, it would make sense why the gonadal tissue would be affected by this disorder. This next slide also discusses symptoms, however, it's more a continuation of the physical aspects. Physical abnormalities are more prominent as the individual ages. The individual would have a long, narrow face with large ears, a more prominent jawline or forehead, flexibility in fingers, and flat feet. Males are also at risk of enlarged testicles after puberty. Individuals with FXS have a normal life expectancy, but will have long life learning and communication disabilities along with physical abnormalities. To my left, we see a picture of an example with somebody with physical attributes of Fragile X syndrome, where they have the long jaw, the enlarged testicles, and the flat feet. There are also some other symptoms that are included in the chart, such as soft skin and hyperextendable joints. Now we come to discuss diagnosing FXS. Some prenatal tests include amniocentesis, which is testing the amniotic fluid. Another test includes chorionic villus sampling, which is testing cells from the placenta. However, prenatal tests are not very common as parents may not know they carry the mutation. Tests are done after parents recognize symptoms in their children. When children show signs of speech or emotional struggles or physical disabilities, a healthcare provider might recommend parents get their child tested. A patient's DNA is diagnosed by a blood test. Options. FXS is for life. It cannot be cured, but it can be treated. Since FXS causes both emotional and physical issues, different symptoms require different treatments. Since this genetic disorder can cause different things like ADHD, compulsive disorders, mood swings, or seizures, since there are already prescription medication that can help with those items alone, these items are prescribed for patients who have this genetic disorder. For example, patients who suffer from mood swings or seizures are prescribed something called Neurontin, which is right here in this top right corner. Let's see, moving this. Patients who experience ADHD can be prescribed Ritalin. That's a very common one. And then right at the bottom right here, to help with compulsive or aggressive disorders, we have Zolofit right here in the bottom. And these are also prescribed to patients with FXS who show any symptoms of either mood swings, ADHD, or compulsive or aggressive disorders. FXS in terms of artificial intelligence tools. From the Weizmann Center at the University of Wisconsin-Madison, researchers were able to use an AI system to discover indicators of FXS. The system used 1.7 million records of medical history from patients over the last 40 years. The AI model was able to predict FXS within a patient 5 years earlier than individuals would have been using traditional methods. FX is often difficult to diagnose since there is no obvious specific characteristic to look out for other than behavior. So right here in the bottom we have the logo for the Weizmann Center, University of Wisconsin. Let's see. So the main issue in diagnosing FXS is that there's no real indicator besides genetically looking at either the fetus, the child, and people only really start considering that their child might have FXS if they have behavioral problems or some kind of physical disorder. Continuing on into artificial intelligence tools, once again, FXS is a very challenging disorder to diagnose because of its clinical diversity. There is no physical characteristics at birth that indicated the disorder, mainly its behavioral issues. Artificial intelligence uses electronic health records to quickly diagnose FXS at once again 5 years sooner than traditional methods. When compared to traditional methods, AI diagnosis was 80% more accurate. So as you see right here is a little picture. Whoa, look at that little iPad. So basically, the AI system was fed lots of records of FX syndrome, and they were able to detect a pattern, and in those cases, it was accurate. And that concludes my presentation on Fragile X syndrome, also known as FXS. Here are my information citations. There were also grayish citations on every image and information. And thank you.